channel. If you've never joined us before, my name is Dr. Jennifer Sue, and this is my husband.
I'm Dr. John Lucio. I practice integrative medicine and pain management in Jefferson City, Missouri.
And I practice conventional gynecology and integrative medicine. If you've never subscribed, please do so. We upload 2 videos a week all about integrative medicine topics and how to handle them from an integrative medicine perspective. And if you haven't gotten your tickets for Healthy You, you better get them now because the early bird special ends September the 30th. So check it out on www.healthyuconnect.com. Today's topic is very personal to us. Dr. Lucio, my husband, wants to make sure that you all are taking care of your hearts. He had a recent heart attack and wants to review his labs and the importance of all these labs.
Yep. So, I discussed doing this with my wife a few months back, and I mentioned it in our YouTube channel. I think it's very important that we bring it up to help explain to everybody what to look for in their own, I'm going to call this lipid profile, which includes your cholesterol, triglycerides, HDL, and LDL. And most people know what that is, but there's actually a lot more detail and it's more complex than you think. And also some things you can do to help improve your overall health. And these are things you can discuss with your physician anyway, and then you can actually make sure you have the proper recommendations. But to start off with, the best way to go about this is just kind of show what my lipid profile was back in October, a day after I had my heart attack, and then 3 months after I started on medication. So we're going to switch to that now, and so you can see it.
So I'm going to be behind the camera next. I'm going to focus on his labs and while he's writing them, so it'll just be easier. So hang on.
Okay. All right, just to start off with, look at my cholesterol panel or my lipid panel back in October 10/4/2018. You can see my cholesterol was below 200, which was okay. HDL, LDL were within normal limits, and triglycerides looking not bad. And then the day after my heart attack, this is May 15, 2019, these were my labs drawn the next morning. And you can see there's a big drop, actually, which is kind of interesting. So I still had the heart attack in spite of this drop. And so what happened here? Well, the only thing I changed, and I wasn't taking any medication at this point, the only thing I changed was I had started intermittent fasting back in March. Now, if those of you that don't know what this is, please look it up. It's a fascinating way to go about how you do your eating and when to do your eating. And for me, I tend to be very sensitive to it, and I noticed this big drop in especially my cholesterol went down to 169, and this is the most remarkable one. The LDL went from 136 to 114.
And LDL stands for lousy. We want the LDL to be low,
right? Less
than 100. The
right.
HDL is the good cholesterol. That's happy.
Correct.
I learned that from one of our friends. So HDL is happy, LDL is lousy.
So then you look at the lipid profile from May then to July. This is actually just barely 2 months later after I'd been on statin medications. And you can see my cholesterol level dropped dramatically to 103. And my HDL really went up about 9 points. The LDL had the biggest drop from 114 to 45. Now, of course, that's explained easily by the medication I'm taking. This is exactly what it's for. And my triglycerides also went down from 74 to 32. Now, here's the interesting thing. So from May to July, not only did I measure the regular lipid profile that everybody gets, but I also measured something called Lp(a). Now, we're going to talk about this because it's a component of the LDL.
The whole name's called lipoprotein(a).
Right. And as you can see, my level's elevated, 240. So in spite of all these nice-looking numbers with my statins, my levels are elevated. And this actually indicates that I'm actually increased risk for a cardiovascular event. So my job is going to have to lower this down. So again, going over this, October to May, only change was intermittent fasting, no medications at this point, going from here to here, dramatic decrease in it. Now the other thing I did, I started doing advanced lipid testing. Now I'm going to talk about that.
Okay, we're back.
I'm going to talk a little bit about what is called advanced lipid testing. Now, the reason I bring this up is that when we get our blood taken, we're giving the conventional measurements like cholesterol, triglycerides, HDL, LDL, and we don't have a good breakdown of some of the other markers for cardiovascular events. And actually, I asked for that because my numbers were low. And surprisingly enough, this is not unusual. At least 50% of the population, especially men, will have a heart attack even when their numbers are actually doing pretty well. So it's important that not only do you focus on the numbers, but you also practice lifestyle changes as well. And we discussed this in our last YouTube channel episode where we did talk about cardiovascular disease and some of the integrative medicine approaches for that. But it's important you maintain a good diet. Mediterranean diet is an excellent diet to follow, or an anti-inflammatory diet. Meditation really helps with lowering your blood pressure and also decreases the overall stress. And speaking of blood pressure, if you have that as well, which I do, slightly high, I do need to have that better controlled. So getting back to the advanced lipid testing, I did look at Lp(a). It is a marker for increased cardiovascular risk, but there are some other markers. There's not one particular blood test that you can look at that says, okay, that alone is going to predict that you're going to have a heart attack, but there's some others as well. And I had those drawn for myself. One is called C-reactive protein, which is a measure of overall inflammation. I looked at that. I made sure I wanted to know what my levels were. I looked at what is called my homocysteine level. That also has been shown if it's elevated, it puts you at increased risk. I had my vitamin D level checked again, because that also, patients that have vitamin D deficiency also have increased risk for heart disease. And I looked at some of the other profiles in the blood test as well. I'm a candidate for this test because I had relatively low lipid numbers, but I still had a cardiac event. And not everybody's a candidate for this, and I'm going to explain to you why. In our country, when we get conventional lipid testing done, the thinking is Lp(a) cannot be changed. Really, the only thing that's been shown right now to really change it conclusively has been niacin. And there are some side effects of taking that.
One thing about niacin is if you buy the no flush, it's not as good. So do not buy the no flush, which means you get flushing from niacin.
Right.
Don't buy that.
Yeah, there's an extended release form which actually is better tolerated. I've been taking it now for maybe 3 or 4 weeks, and I do notice a slightly flushing effect, but if I take it with food, I don't seem to feel it as much. Also, it can cause you some reflux, which I realized when I was taking it at night because I didn't want to feel the flush. I wanted to sleep through it, but I ended up having a reflux symptom. So make sure you take it with food. And I did take it during the day, and I found it's really only very mild. It's not big a deal. So the best strategy right now really is to, number one, make sure I take my statins. Now, I'm on Crestor and Zetia, which are two very common ones done, and it's oftentimes given as a combination therapy. And there's reasons, biochemical reasons for that. Now, interestingly enough, when I started doing my research on it, I found a lot of folks really think this is controversial. They don't recommend even starting statins, which I think is ridiculous, but really look closely at who's telling you this. And the studies right now, as they exist, show there's a very good evidence that it can improve survival rate and decrease your future risk. So it's important that you do that. Now, what other things am I going to be doing? Well, I did look at my homocysteine level. It's slightly elevated. I'm going to do my best to decrease it by increasing my folic acid intake. And now, however, when I read the studies on folic acid intake in terms of how it does it improve survivability and reduce cardiovascular risk, so far the studies are not very conclusive. Now, is it going to hurt me to take and make sure I've got a healthy supplement of folic acid? No, it's not going to hurt me. Maybe it'll help. So I'm going to focus on that. I am going to increase my vitamin D intake. My level was 29, okay, which conventional labs indicate that 30 is the bottom number. Okay, so I was slightly decreased, but now we're learning that optimal health, you should have a level at least 50 to maybe even up to 70. So I'm going to be working on that, and the supplement I'm going to be using is a vitamin D3 supplement. Okay, not vitamin D2. It tends to be cheaper, but doesn't get absorbed as well as a vitamin D3 supplement. In terms of blood pressure control, again, if you're on medication, there are some things you can take in addition to it that allow you to decrease the dosage that you're taking. One of them is magnesium, 500 milligrams at night, can actually help improving your blood pressure. Other things you can do is increasing your blood levels of nitric oxide, and I do that by taking beetroot juice in either a powder form or a capsule. And so those are some of the things I'm going to be doing as well. Now, I'm going to be checking my labs again in about 3 months, and we're going to be going over the lipid profiles again and just seeing how the statins and all these interventions change my health. Now, hopefully, all these things together will decrease my future risk of cardiovascular disease. Got my fingers crossed. I'm hoping the studies are correct, and then we'll go from there.
Can you go through some of the symptoms of what you experienced in your heart attack?
For those of you that are not familiar with the symptoms that you can get when you're having a heart attack, I'm going to tell you what mine felt like. I was on an exercise bike. Actually, I was at the end of my workout, and I just felt a little bit short of breath, but really not bad considering how much I was pedaling. But then I started feeling a pressure sensation, and it literally felt like someone had their one hand on my chest, the other one on my back, like this, and was pushing on my shoulder.
So one hand's on.
Like this. And I took a drink of water, and in 10 minutes it went away. And then I took a shower, talked to my wife, and then went to work. And
but you didn't tell me.
I didn't tell her because I didn't really, I kind of knew what it was, but I thought, maybe I was wrong.
I knew something was funny because you always say, "See you later, sweetie, have a good day." And this time, he just left and closed the garage door. So if your spouse is acting funny, ask him.
All right. More funny than usual. So anyway, so I went to work, and then the pain came back, and long story short, I ended up having a stent placed. But it was very interesting because by the time I got to the emergency room, the pain was gone, and my EKG was okay. The other symptoms you really need to look out for, too, is if you start having long refractory reflux symptoms. In other words, it doesn't get any better when, heartburn doesn't get any better when you start taking antacids. It's getting worse throughout the day. Get that checked out because that can also be an indication. Some people feel pain in their teeth, sometimes just in the front part of their chest, either side of the shoulder. Mine was a classic symptom, I think, and I pretty much knew what it was. So don't ignore it and make sure you get it checked out. And if you're a woman, women tend to have different sensations and symptoms of a heart attack. So if you have anything that just feels remotely like that, if you feel dizzy or something's just not right, it's better just to have it checked. Well, that's it for today. Thank you all for joining us.
This week's midweek check-in is going to be about licorice roots and its health benefits.
All right, so please join us in 2 weeks for our next installment of J&J House Call, where we will be discussing integrative approaches to help people get off of narcotics.
Bye.
Bye-bye.